You've probably been told there's nothing that can be done about your neuropathy. And if you've been living with burning, numbness, or that constant pins and needles feeling, maybe you started to believe that. But here's what the research actually shows. Peripheral nerve fibers are not frozen in place. They are in a constant competition, a daily tug of war between fibers breaking down and fibers trying to regenerate. Which side wins depends in large part on the environment you create for your nerves. And that environment is something you have real influence over. Today, I'm going to walk you through 5 nutrients that each target a different piece of that biological puzzle. And I'm going to show you the actual clinical data, not just the theories. My background is in peripheral nerve surgery, and I now work with patients online who've been told there's nothing they can do about their neuropathy. What I've found and what the literature supports is that most people with nerve symptoms have never been told about that metabolic environment their nerves are living in. That's what we're going to fix today. Before we get into the 5 nutrients, I want to explain something that most neuropathy videos completely skip over. The reason a single supplement almost never moves the needle is that the nerve damage doesn't just come from one place. There are at least 5 distinct biological targets involved in peripheral nerve degeneration. There's the toxic buildup of advanced glycation end products called AGEs that damage nerve tissue. There's mitochondrial stress, where your nerve cells are producing more damaging free radicals than they can neutralize. There's reduced blood flow to the small vessels that feed your nerves. There's the structural breakdown of myelin, the insulating sheath around your nerve fibers. And there's a deficiency in the growth factors your nerves need to maintain and regenerate themselves. One nutrient hitting one target is rarely enough. What the science points towards is complementary coverage, multiple agents addressing multiple nodes simultaneously. A 2025 in vitro study confirmed this directly. A combination of B1, B6, and B12 produced superior neurite outgrowth compared to any single B vitamin in isolation. Let's start with the 2 agents that go after the metabolic and oxidative damaging side of the equation. Benfotiamine is a fat-soluble form of vitamin B1 that achieves dramatically higher tissue levels than standard thiamine. Its primary mechanism is activating an enzyme called transketolase, which reroutes toxic sugar metabolites away from the 3 main pathways that damage nerve tissue: AG formation, PKC activation, and hexosamine pathway. A landmark Nature Medicine paper called this a quadruple blockade of hyperglycemic nerve damage from a single mechanism. Short-term clinical trials, the BEDIP and the BENDIP studies, showed statistically significant improvement in neuropathy symptom scores, particularly pain, at doses of 300 to 600 milligrams per day. The evidence is stronger for people with known B1 insufficiency and for symptom relief in the short term. Now, alpha-lipoic acid is arguably the most versatile antioxidant we have for nerve tissue. It scavenges free radicals in both water-based and fat-based environments, which is rare. It regenerates glutathione, vitamin C, and vitamin E, essentially amplifying your entire antioxidant network rather than just adding one more player. It also improves blood flow to the small vessels that feed your nerves by protecting nitric oxide from oxidative breakdown. The clinical data on alpha-lipoic acid for neuropathic symptoms is some of the strongest we have in this space. A meta-analysis of 4 trials, over 1,200 patients, showed a 24% reduction in total symptom scores versus placebo, with over half of patients achieving a 50% or greater reduction in symptoms. The Sydney 2 trial showed a 51% reduction in symptom scores at 600 milligrams per day over 5 weeks. And a 2023 meta-analysis of 10 randomized controlled trials confirmed significant improvements in neuropathy scoring, neurological and patient-reported global satisfaction with a dose-dependent effect. Methylcobalamin is the neurologically active form of B12, and this distinction matters. The common synthetic form, cyanocobalamin, requires your body to convert it to methylcobalamin before it can be used. In older adults, people with kidney issues, and those with chronic diseases, all of which overlap heavily with neuropathy patients, that conversion is impaired. Methylcobalamin delivers the active form directly. Its role in nerve repair is structural. Cobalamin is required for myelin synthesis, and research in Schwann cell models has shown it promotes remyelination and functional recovery after A multicenter randomized trial in 232 patients showed methylcobalamin at 1,500 micrograms per day produced significant reductions in neuropathy symptom and disability scores, with nerve conduction velocity also improving. A systematic review found that methylcobalamin was more consistently effective in combination than alone, which again reinforces the multi-target principle. B6 rounds out the B vitamin picture by supporting neurotransmitter synthesis. It's a required cofactor for making GABA, serotonin, and dopamine, and by helping control homocysteine, a compound that when elevated independently damages peripheral nerve tissue. The key with B6 is dose at lower physiologically appropriate levels. It supports nerve function. The clinical data supports conservative dosing for sustained nerve health. All 5 agents, acetyl-L-carnitine has the most surprising and clinically underappreciated mechanism. Acetyl-L-carnitine levels are measurably depleted in diabetic neuropathy, in HIV-related neuropathy, and in chemotherapy-induced neuropathy, meaning there's a documented deficiency state, not just a theoretical benefit from supplementation. Acetyl-L-carnitine does 3 things that nothing else on this list does. First, it upregulates nerve growth factor and its receptor, directly addressing the NGF deficiency that drives sensory neuron loss in established neuropathy. Second, and this is the part most people don't know, it produces pain relief through an epigenetic mechanism. Acetyl-L-carnitine acts as an acetyl group donor that modifies a transcription factor, and then this increases expression of a receptor in your dorsal root ganglia that reduces pain signaling. This effect takes several days to develop, but it persists for 2 weeks or more after you stop taking it. That's a fundamentally different mechanism than anything in the painkiller category. Third, structural regeneration. Trials, 2 parallel randomized controlled trials in over 1,200 patients, showed significant increases in sural nerve fiber numbers and regenerating nerve fiber clusters on biopsy, actual structural evidence of nerve fiber regeneration in a human clinical trial. A meta-analysis of pain data showed a 24.6 reduction in pain scores versus placebo, specifically in diabetic neuropathy patients. So here's the clinical picture. Each of these 5 agents hits a different target in the nerve damage cascade. Benfotiamine goes after the metabolic toxicity. Alpha-lipoic acid neutralizes oxidative stress and improves blood flow. Methylcobalamin supports myelin repair and structural integrity. B6 handles neurotransmitter synthesis and homocysteine. And acetyl-L-carnitine addresses NGF deficiency, provides an epigenetic analgesic effect, and supports actual structural nerve fiber regeneration. The research is clear that combined coverage outperforms any single agent, and that's exactly the logic behind the formula I developed called NeuroAxis, which you can find at drfitznutrition.com. It's formulated around this multi-target science. And if you want to understand how each ingredient maps to the physiology I've described today, the site walks you through all of it. If you found this useful, the most important thing you can do right now is share it with someone who's been told there's nothing they can do, because that's simply not what the research shows. Subscribe now so you don't miss the next video.